Hello, my name is Christian Letzinger, and I graduated from St. Anthony College of Nursing in May of 2015, got my license shortly thereafter, and started working as a critical care nurse at Swedish American Hospital. I'm going to briefly be talking to you about your upcoming Interprofessional Education Day, what my expectations were going into it, a small glimpse of the experience itself, but really how it's helped me be successful as a nurse now that I'm out in the workforce. I really wasn't sure what to expect of this education day. I mean, I know throughout nursing school we had always been taught the importance of interdisciplinary teamwork and being able to really effectively communicate with physicians and pharmacists and other ancillary staff to best serve our patients. I just didn't realize how much of my role as a nurse it really was. So through this experience, we got to meet med students and pharmacy students and work through some patient scenarios and simulations to really learn what each discipline's role was with the patient, but also how they overlap and how we have to work together. We then had to come together as physician, pharmacist, and nurse after watching videos of a patient from admission to discharge and actually meet with that patient face to face and discuss the patient's condition, the course of treatment, medications, care the patient may need post-discharge, and really work together to make sure that that patient knew what was going on and was going to have the best outcome possible. Initially, I thought there's no way this would happen in the real world. The hospital's way too busy. No one's schedules align like this. Now that I'm working, I realize just how wrong I was. Back when I was on days in critical care, every day at 10 a.m. we would have patient rounds where we would come together with the intensivists, the pulmonologists, cardiologists, pharmacists, nutritionists, PT, OT, speech therapy, case management, infectious disease, and even the chaplain. Really, anyone who had a hand in patient care. And together a plan was made for the day for that patient. Now that I'm on nights, I have to communicate even more effectively because I talk to so many different hospitalists or our physicians in Madison through the television or the phone, and I have to update them on patient conditions in order to get orders for treatment. Lastly, where I see interdisciplinary teamwork the most is when I respond to an ERT or a code blue, because there's so many people working in that room on a patient. You have the physician who is actually running the code, the pharmacist who is drawing up meds and handing them to the nurse to give, nurses who are also doing compressions, respiratory therapy who are manually bagging the patient, and often a chaplain to console the family if they were present at the time. So you really, really have to be able to work effectively together in this situation to best serve the patient. I really hope you all go into this education day with an open mind and an understanding of just how crucial this is to the work you will be doing in the future. Because families and patients like to see teamwork, and they like to know that their needs are being met. And the best way to do that is by working closely and effectively with your peers and the disciplines around you. Enjoy.